The PJI program at Ohio State has many ongoing research efforts. It's one area in orthopedics that has not improved over the past 25 years, and we have multiple studies ongoing. One of the studies includes a novel antimicrobial agent that is a peptide. It's a small piece of a protein that can work on any bacteria or any fungus. We are currently looking at a device that stays in a knee for 1 week. It's a device that's part of a two-stage procedure. So these are devices for patients that have a chronic infection. We take out the initial implant. This implant goes in for a week. I sometimes refer to this temporary implant as a sprinkler system. It has a lot of holes in it, and it has 2 catheters that are hooked to it. On an hourly basis, we will infiltrate antibiotics through this device. It will come out through many of the openings in both the knee and the hip replacement, delivering the antimicrobial fluids or the antibiotics everywhere around that knee replacement, including inside the bone. You keep that implant in for a week, and then we take that back out, and at the end of the week, we will re-implant a total knee or a total hip. We've got great preliminary data on that device. We have recently published some of that data. We are showing an almost 5 to 10% improvement over the traditional two-stage approach to the treatment of chronic periprosthetic joint infections. We have currently just finished up phase 3 of the research on that device. We are currently waiting for its commercial release. We are waiting on the FDA to give us clearance, and we will have that hopefully coming out on the market within the next year. We are also looking at bacteriophages, and we have several upcoming studies with a bacteriophage. And bacteriophage literally means virus eater. Bacteriophages have been in the world for millions of years. They find them in the most disgusting of places. We look for bacteriophages in places like dirty rivers, like the Ganges. We look for them in outhouses and in septic tanks. But these are viruses that kill off bacteria. There is some value to bathing in some of these rivers and some of these places because that's where these bacteriophages are. But we can discover, or we have a library of these phages, and we will then also give those to patients. There's really a lot of really recent interest in treating or with investigating bacteriophages, especially with the development of resistance to antibiotics. The Eastern Bloc countries, areas in the Russian area, and that part of the world has had ongoing research for a number of years. But here in the United States, over the past 5 years or so, there's really been a renewed interest at looking at bacteriophages. We've been involved with several studies in the past, and we have involvement with 1 or 2 studies that are coming up in the future. And that'll be one more thing to help with our fight against these very difficult infections that we're treating here. Any patient that presents to the Ohio State University with a periprosthetic joint infection will be evaluated and assessed and see if they are able to be enrolled in any of our research efforts. We have multiple studies going on, and if they're a candidate for one of our research efforts, we will certainly enroll that patient into that study.